Okay, hi, I'm Mary. I've been a patient of Dr. Johnson's for a very long time. I don't even know how many years, probably at least 17 years, maybe longer than that. But earlier this year, in February, mid-February, I was diagnosed with Graves' disease, which is an autoimmune disease that relates thyroid issues with eye issues. I had hyperthyroidism. My thyroid gland was producing too much of the TSH, thyroid hormone. So I explored it through eye doctors and went to an endocrinologist, and he put me on thyroid medication. It was a thyroid blocker to help stop my thyroid from producing so much. Low dosage, but it was that or drink the iodine, get rid of my thyroid, and be on medication the rest of my life, and I wasn't ready for that option. So started the medication, and in the meantime was exploring this autoimmune issue with Dr. Johnson, because when he saw my blood work, he said the same thing. You have an autoimmune issue going on here, but he suspected maybe celiac, because he said if I had the celiac gene, it would be near the thyroid gene, and that could be why the autoimmune issue was attacking my thyroid. And then with the Graves too, I had some bulging and retraction of the eyelid, which is what made me even realize I had an issue to begin with. So that was kind of a blessing. But so I'm on the thyroid medication, and Dr. Johnson and I were exploring this, and I did the tests that he recommended to see if my body built antibodies against gluten, dairy, egg, soy, and yeast. Well, I had an issue with every single one of them. I had the celiac spruce gene, and I also had a gluten-sensitive gene. So as soon as I found that out, I decided to just take all that out of my diet. And I've learned a lot since then too, because some of the things that I thought were gluten-free have hidden things in them, and at that time I didn't realize. But as I started Dr. Johnson's program, he gave me a ton of information and websites and foods to eat and dietary ideas and recipes and stuff like that. So I learned more about, what else to stay away from besides just the obvious stuff that has, grain in it. But anyway, even without those specifics yet, I stood away from all of those things and decided to do one of the programs that he offers. The 6-month program is what I chose. But just within 3 months of not eating those foods, I was off my thyroid medication, which made me extremely happy since I don't like being on medication. Anyway, so then my family went on vacation, and when I came back, I started the program. Which includes just very comprehensive diet, supplements, and all kind of treatment programs. So since I started the program, which has been probably just over a month, so I've been eating this way, minus all those foods, for like 4 months now, but just over a month since I've been on the actual 6-month treatment program. And I had a rash on my ankle from the Graves' disease. Very itchy, thick skin, thick, crusty skin, and it would kind of go from ankle to ankle. Well, the rash is totally gone, and my skin is normal again. That was one thing. I had knee pain in my left knee when I would remain idle, and that was for months. That was when I noticed the eye issue. So that was like from the beginning of the year. For months I had this knee pain. So I know it wasn't I twisted it, or it wouldn't have taken that long to heal. It was, I don't know, 5, 6 months that I had this. So that's totally gone. I don't have that knee pain anymore. I used to stand up from my desk and limp when I walked for like the first minute until my body warmed up or whatever, my knee warmed up. But that's totally gone. I had symptoms of a racing heart probably 1 to 2 times a day, maybe 3 to 4 times a week. And in the last month, I've noticed maybe 1 or 2 times for the whole month. So that's definitely gotten better. And then less stomach bloating and gas. I've definitely noticed a difference. In fact, went to my cottage last weekend and I had some chips there, and normally like 20 minutes after I would have eaten those, I would have already like started to have gas, like nothing. I'm like, wow, that's awesome, because I didn't even take an enzyme, you know. I was just, we were outside, we were at the cottage, and like, oh, that's awesome. So I've noticed all of those things just within just over a month, and then, you know, off my meds, just staying on the diet that he recommended for me for those 3 months.
That's great.
So I'm thrilled, and I can't wait to continue doing all the things that I've been doing.
All right, we will talk to you then maybe in another month or two.
Yeah, sure.
Okay.
Sounds good.